In today's video lecture, we will be learning about pharmaceutical incompatibilities under the codes of pharmaceutical technology. So let's begin. So drug or pharmaceutical incompatibility refers to the interaction between two or more substances which lead to changes in chemical, physical, therapeutical properties of pharmaceutical dosage form. So it can be of three types as per the definition, like physical incompatibility, chemical incompatibility, and therapeutic incompatibility. First of all, therapeutic incompatibility. As the name suggests, it means any incompatibility of drug or excipients or drug regarding their therapeutic action. So it is the modification of the therapeutic effect of one drug by prior concomitant administration of another. It's also called drug interactions. So it can be of two types, like pharmacokinetics and pharmacodynamics. So pharmacokinetics involve the effect of a drug on another from the point of view that includes ADME, and pharmacodynamics are related to the pharmacological activity of the interacting drugs like synergism, antagonism, altered cellular transport, effect on receptor site. So let's discuss with the pharmacokinetic interaction, which begins with the absorption. Okay, sometimes one drug may interfere with the absorption of another drug. So there are a number of mechanisms for interacting with the absorption of another drug, uh, like altered pH, altered bacterial flora, in formation of drug chelates or complexes, drug-induced mucosal damage, and altered GIT motility. So in this case, first of all, we already concerned about the absorption site. Actually, GIT is the absorption site. And absorption means availability of the drug in the systemic circulation from the GIT. So altered pH, the non-ionized form of a drug is more lipid soluble and more readily absorbed from GIT than the ionized form does. So in case of antacid, we know that it increases the pH. Okay, but in this case, the decrease the tablet absorption of ketoconazole. We know ketoconazole is an acidic drug which get better absorbed into the stomach, because acidic drug will absorb in the stomach, because in acidic media it would be non-ionized. But whenever we are taking antacids or H2 antagonist, it will increase the pH. So whenever pH is increasing, then some of the drug would be ionized. And this is the case regarding altered pH. Hence, it decreases the tablet absorption of ketoconazole. Therefore, these drugs must be separated by at least 2 hours in the time of administration of both. Then, altered intestinal bacterial flora. In 10% of the patient receiving digoxin, 40% or more of the administered dose is metabolized by the intestinal flora. Antibiotics kill a large number of normal flora of the intestine, like increase digoxin concentration and increase its toxicity. Then complexation or chelation, like tetracycline interact with iron preparations, or you know milk. It contains calcium which would interact and will form chelate with tetracycline, and which ultimately lead to the formation of an absorbable complex. Like antacid contains aluminum or magnesium. Okay, this aluminum or magnesium is like as calcium, which will form chelates with ciprofloxacin. Then drug-induced mucosal damage. Some drugs like cyclophosphamide, vincristine, or procarbazine. Okay, these are actually the side effects of anti-neoplastic agent or anti-cancer drug. They can induce mucosal damage, and these mucosal damage will ultimately inhibit the absorption of several drugs like digoxin. Then altered motility. You know, altered motility, for example, in case of metoclopramide, which is an antiemetic drug, its mechanism of action is regarding its decrease of gastric motility, because it acts as antiemetic drug. So why emesis is formed? Because of the GIT motility. Okay, so antiemetic drug decrease the GIT motility, but it increase the absorption of cyclosporine due to the increased stomach emptying time. So whenever GAT motility has decreased, more drug or food will remain in the stomach for a longer period of time. So whenever they will stay in the stomach for a longer period of time, some drugs which get absorbed in the stomach will have better concentration, will have very higher concentration than normal, like cyclosporine. This drug usually absorbed from the stomach. Okay, so it causes the toxicity of cyclosporine. Then displaced protein binding, it depends on the affinity of the drug to plasma protein. The most likely bound drug is capable of displaced other. The free drug is increased by displacement by another drug with higher affinity. Like phenytoin is a highly bound to plasma protein, tolbutamide, and warfarin. Drug that displace these agents are aspirin, sulfonamides, phenylbutazone. Then altered metabolism. Okay, regarding the ADME, we have discussed already A and D. Now it is the metabolism M. The effect of one drug on the metabolism of other is well documented. The liver is the major site of drug metabolism, but other organ can also do. For example, WBC, skin, lung, and GI3. Then cytochrome P450 family is the major metabolizing enzyme in phase 1 oxidation process. Therefore, the effect of drugs on the rate of metabolism of other can involve the following examples, like enzyme induction. A drug may induce the enzyme that is responsible for the metabolism of another drug or even itself, like carbamazepine increases its own metabolism. Phenytoin increase the hepatic metabolism of theophylline, leading to the decreased level and reduce its action, and vice versa. So phenytoin, which increase the enzyme activity or hepatic enzyme activity of metabolism for theophylline. Whenever it get metabolized, the main function of metabolism or main purpose of metabolism is the degradation. Okay, degradation or detoxification or alter the therapeutic activity or structure of the theophylline. So whenever it get metabolized, obviously its concentration will decrease, and it will ultimately reduce its action. Then enzyme induction involve protein synthesis, therefore it needs time to 3 weeks to reach a maximal effect. Then enzyme inhibition, it is the decrease of the rate of metabolism of a drug by another one. This will lead to the increase of concentration of the target drug and leading to the increase of its toxicity. Inhibition of the enzyme may be due to the competition of its binding site, so the onset of drug action may be within 24 hours. When an enzyme inducer is administered with an inhibitor, the effect of the inhibitor will be predominant. For example, erythromycin inhibit the metabolism of estimazole, and tarfenadine increase the serum concentration of the antihistaminic agents, leading to the increasing the life-threatening cardiotoxicity. Okay. Moreover, omeprazole inhibits the metabolism of diazepam. So these are some of the examples in which enzyme inhibition happens. So in these cases, when enzyme inhibition happens, then obviously its free drug concentration will increase. Okay. Then fast pass metabolism, oral administration increase the chance of liver and GI metabolism of drug, leading to the loss of the part of the drug dose, decreasing its action. This is more clear when such drug is an enzyme inducer or inhibitor. For example, rifampin lowers the serum concentration of verapamil level by increase its fast pass. Also, rifampin induces the hepatic metabolism of verapamil. Then altered renal excretion, sometimes our drug may interfere with the renal excretion of another, because renal excretion incorporates the glomerular filtration rate, active tubular secretion, then tubular reabsorption. So whenever tubular secretion or any reabsorption happens, it involves different enzymes or different proteins regarding the absorption site of nephron, and that's why sometimes drug may compete with one another regarding the absorption. So it occurs in the proximal tubule. The drug combines with specific protein to pass through the proximal tubule. When a drug has competitive reactivity to the protein that is responsible for the active transport of another drug, this will reduce the such drug excretion, increase its concentration, and hence its toxicity. For example, probenecid decrease the tubular secretion of methotrexate. Okay, so when it will decrease the tubular secretion of methotrexate, then methotrexate concentration will increase in the blood. and it may cause toxicity. Okay, so be careful about taking probenecid and methotrexate simultaneously. So we can see here different drugs which can cause inhibition, and these are the drugs whose T half may be affected. Then alteration of urine flow and pH, excretion and reabsorption of drugs occur in the tubule by passive diffusion, which is regulated by concentration and lipid solubility. Ionized drugs are reabsorbed lower than non-ionized one. Loop and thiazide diuretics indirectly increase proximal tubular reabsorption of lithium, and this can cause lithium toxicity in patients treated with lithium carbonate for mood disorders. The effect of urinary pH on excretion of weak acids and base is put to use in the treatment of poisoning, but is not a cause of accidental interaction. Then pharmacodynamic interaction. It means alteration of drug action without change in its serum concentration by pharmacokinetic factors. Like you know, pharmacodynamic interaction means drug will interfere with the receptor site. Okay, so it can be of different types like additive effect, synergistic effect, then potentiation effect, and antagonistic effect. So let's discuss one by one. First of all, additive effect. Additive means 1 plus 1 is equal to 2. Okay. It occurs when two or more drugs having the same effect are combined, and result is the sum of individual effect relative to the doses used. The additive effect may be beneficial or harmful to the client. Then synergistic effect occurs when two or more drugs with or without the same overt effect are used together to yield a combined effect that has outcome greater than the sum of the single drug active components alone. So synergistic effect means 1 plus 1 is equal to 3. Then potentiation describes a particular type of synergistic effect, a drug interaction in which only one of two drugs exert the action that is made greater by the presence of the second drug. Potentiation means, so 0 plus 1 will be equal to 2. That is potentiation. So potentiation means, for example, whenever you are taking drugs like penicillin and clavulanic acid, okay, at the same time, clavulanic acid has no therapeutic activity, but penicillin has, and it's an antibiotic. But whenever they are taking in combined way, then just clavulanic acid will help in the increasing of concentration of penicillin. Okay, but clavulanic acid has no its own mechanism of action, or has no any therapeutic activity of its own. Okay, but it can cause an effect, okay, by modulating the ADME profile, or the binding profile, okay, of penicillin. So this is potentiation. Okay, then if we talk about the example of additive effect, like say if you take two cox inhibitor at the same time, then you will find some additive effect. Then synergistic effect, it means increasing the activity, like whenever you are taking alcohol and sedatives simultaneously, then obviously it will cause a dramatic effect. Okay, then antagonistic effect, I think you are very much aware of this. Its reactions have the opposite effect of synergism and result in combined effect that is less than either active component alone. Okay, that means 1 plus 1 is equal to 0. Okay, for example, whenever you are taking protamine, okay, of and heparin, then these will just counteract the activity of another, because this is coagulant and heparin is anticoagulant, like atropine and physostigmine. Okay, they are antagonistic to one another. Okay, atropine or acetylcholine, they are antagonistic to one another. So the examples along with the equations has been shown here. So some examples has been given of antagonism. Warfarin competes with vitamin K. Beta adrenoceptor antagonists diminish the effectiveness of beta receptor agonists like salbutamol or terbutaline. Okay, many diuretics lower plasma potassium concentration, thereby enhance some action of digoxin and predispose to glycoside toxicity. Okay, these are the examples of antagonistic effect. Then physical incompatibility. Physical incompatibilities are often called pharmaceutical incompatibilities, like interaction between two or more substances which lead to the change in color, odor, taste, viscosity, and morphology. Manifestation of physical incompatibility. The following list outlines the various ways incompatibility between or among drugs agent may be manifested, like insolubility of prescribed agent in vehicles, immiscibility of two or more liquids, liquefaction of solid mixed in a dry state. Okay, like insolubility, the following factors affect the solubility of prescribed agent in vehicles and may render it less soluble, like change in pH, milling, surfactant, chemical reaction, complex formation, co-solvent. Any change in previous factor may lead to precipitation of drugs and change in their properties. Okay, so some examples has been given here. Then immiscibility. This manifestation appears clearly in emulsion, creams, lotion, some types of ointment. Okay, regarding emulsion, you have already read about phase separation. Okay, this is some kinds of physical incompatibility. Separation in two phases is noticed in this pharmaceutical dosage form. The following factors lead to immiscibility, like incomplete mixing, addition of surfactant with unsuitable concentration, false time of addition, then unsuitable for the type of emulsion, then presence of microorganism. Then temperature, storage must be in room temperature to prevent separation. Then liquefaction of solid mixed in a dry state. It means that when two solid substances are mixed together, conversion to a liquid state takes place. It happens through the following methods, like formation of liquid mixture when the solid substance is soluble in another solid substance, which lead to decrease of its melting point. Okay, then exit of crystalline water, by mixing hydrated crystals and dry crystals, crystalline water diffuse to dry crystals. Next, we'll learn about some chemical incompatibilities. Uh, it means reaction between two or more substances which lead to the change in chemical properties of pharmaceutical dosage form, like oxidation, hydrolysis, polymerization, isomerization, decarboxylation, addition of carbon dioxide, combination, and formation of insoluble complexes. First of all, oxidation. Oxidation usually oxygen is responsible for this oxidation. Okay, and to prevent this, we sometimes use some antioxidants and some reducing agents. Okay, so oxidation is defined as the loss of electrons or gain of oxygen. It is reaction with oxygen of air which occurred spontaneously without other factors. Pre-oxidants are substances catalyze oxidation process, like metals, some impurities. Factors that lead to the oxidation are presence of oxygen, light. It can cause photochemical reactions. Chemical reactions occur in the presence of light. Then temperature, like elevated temperature, accelerate oxidation reaction. Then the pH is drug has its ideal pH for stability. Any change in pH affects the drug stability and may accelerate oxidation reaction. Then pharmaceutical dosage form, oxidation reaction occurred in solution faster than in solid dosage forms. Presence of preoxidants as metal and peroxidates. Type of solvent used, oxidation reaction occur faster in aqueous solution than others. Then presence of unsaturated bond as double and triple bonds which undergo easier than saturated bonds for oxidation. Then protection of drug from oxidation. So how we can resolve this oxidation process, because this oxidation process will ultimately uh, decrease the activity of our doses form, or even may degrade our doses form. Okay, so we should be very careful about oxidation, and to prevent this we need to take these steps, like addition of antioxidant like vitamin A, vitamin C, inorganic sulfur compounds, thiosulfate, polysulfite. Then addition of the some chelating agents like EDTA, benzalkonium chloride. Then protection from light using the dark container, storage in dark places. Then packaging with substance which absorb light like oxybenzene. Then choice of suitable pharmaceutical dosage forms which reduce the possibility of oxidation process. Then maintenance by pH by using buffered solution. Then choice of suitable solvents rather than water. Then storage in low temperature. So then using good closed container, then replacement of oxygen by nitrogen. However, there are some chemical groups which may undergo oxidation. Okay, like phenolic compound, catechol derivatives, some antibiotics, oils, vitamins. Actually, this contains usually they contain hydroxyl, and the removal of hydroxyl, the removal of hydrogen group is known as oxidation. So, as this contain hydroxyl, sometimes the hydrogen of the hydroxyl is removed from this compound, like phenolic compound contains hydroxyl and hydrogen is removed, then catechol contains hydroxyl and hydrogen sometimes removed. Then antibiotics sometimes contains hydrogen, I mean hydroxyl, and it removes hydrogen. Okay, then some oils and vitamins. So how to identify oxidation in pharmaceutical dosage form? Change of color, odor, viscosity of dosage form. For fixed and volatile oil, change of color, taste, odor, and viscosity. Then hydrolysis, a chemical reaction in which water is used to break down a compound. This is achieved by breaking a covalent bond in compound by inserting a water molecule across the bond. So there are a number of hydrolysis process like ionic hydrolysis, molecular hydrolysis. So ionic hydrolysis means it will form ions, like in which compound is broken into ions by water. The covalent bond between ions and compounds is broken down, like codeine phosphate is converted into codeine and phosphate. Then this type takes place spontaneously. Most affected are weak base and salt. Then molecular hydrolysis, it is a slow process and irreversible. It must be avoided. Then acetyl salicylic acid and salicylic acid, okay, and acetic acid. So there is no solution as dosage form for aspirin. Okay, so there are some groups which may undergo hydrolysis. Starts, amides, nitriles. Actually, to understand it, we need to learn how actually this bond has been formed. Okay, ester is usually formed from the acid and alcohol by the removal of water. So whenever you are using water, then it will ultimately cause the hydrolysis. Same, amide is formed by the reaction of carboxylic acid and amine. So whenever you are again uh, adding water, then this will cause hydrolysis of this bond. Okay, this is also same for nitriles. However, there are a number of factors inducing hydrolysis. Then, like presence of water, pH, high temperature. Okay, so how we will take protection from hydrolysis? As you know, this hydrolysis is very responsible for the degradation of our pharmaceutical doses from. Then, this protection from moisture can be done by packaging with substance impermeable to moisture, then addition of substance that absorb water, and using of solvent rather than water, maintenance of pH by using buffer system, then formation of complexes which protect the drug from the effects of water, then using surfactant like mycelium formation, reducing of solubility of substance, and polymerization. Some monomer will ultimately form a polymer, like formaldehyde will form paraformaldehyde. So there are some factors which may induce polymerization, like temperature, light, solvent, pH, impurities. So isomers have identical molecular formula and different arrangement of atoms. So there are a number of isomerization, like optical isomerization. Conversion of optically active drug into the less active. Adrenaline is more active, but sometimes it may get converted into d-adrenaline, which has no activity of its own. Okay, but sometimes tubercularine which has activity, but if it is converted into tubercularine, then it will not show any activity. Then geometric isomerization, one type of isomers expressed by cis or trans. Cis means in the same side, trans means in the opposite side. Okay, sometimes this may undergo these changes. Then decarboxylation, removal of carbon dioxide. All drugs contain bicarbonate are not sterilized in high temperature. The factors that cause decarboxylation are the same as described previously. Then carbon dioxide absorption. When some pharmaceutical dosage form contains CO2, uh, precipitate is formed. Okay. Then combination takes place when pharmaceutical dosage form contains substance with different charges. Then formation of insoluble complexes like tetracycline and heavy metals. So these are all from our pharmaceutical incompatibilities. If you have any confusion, please inform me in the comment section. Thank you.